So I'm just going to give you a rundown of who we've got with our guest speakers today. So our first guest speaker will be Kelly Stephen, who is our specialist drug and alcohol carers wellbeing worker. A bit of a mouthful, that title. And I've worked with Kelly for over 2 years now in the sort of South team, covering the Adur and Worthing area. But Kelly has sort of covered the whole of the county with various carers, drug and alcohol support groups in Chichester, in Horsham, Crawley, and in the Worthing area. Um, After Kelly's spoken, we're going to have Nicky Smith, who's kindly coming along to talk about her role as the alcohol advisor with Adur and Worthing Wellbeing. And then Caroline will be taking the spotlight with Katie Mardell from the Wittering surgery, who are our spotlight surgery today. And then finally, we will have Daniel Warman, who will be talking with Anna about our new energy project. So a real sort of lineup of speakers today. Lots of information and lots of really good information. So I'm going to hand you over to Kelly, who's going to talk a bit about her role. I may chip in from time to time because we have sort of worked together for such a long time, and I've seen sort of the work and the types of carers that sort of come through to Kelly and the complex nature of some of the carers that she has supported and continues to support. So I shall pass you over to Kelly. Thank you.
Hey, thank you. You have to excuse me, my voice is a bit croaky this morning. Okay, so yeah, drug and alcohol specialist in carer support West Sussex. Probably been doing this about 23 years, and I've been with carer support for nearly 12 years. I'm the only drug and alcohol specialist at the moment. So currently I run two face-to-face groups, one in Chichester and one in Worthing in the evening, and an online group, and these are monthly. And these are for anybody affected by somebody else's drug or alcohol use. Our carers do, as we probably are all aware, feel a lot of shame, guilt, and stigma and being judged. So these groups are very specific for them. And we just offer a confidential and safe place for carers to talk openly with other people in similar situations. And I guess I have noticed probably in the last year, the issues have been much more complex and much more challenging. And this is sort of co-occurring conditions, and there's also been autism, learning disabilities attached to as well as the drug and alcohol, and other carers having other caring roles. We've had quite a few grandparents at the moment who have had to take on the caring role of caring for their children due to their sons or daughters' misuse. And I think I was saying to Mike earlier, a lot of our carers do not see themselves as a carer, and they really struggle with that word. We have encouraged a lot of carers to sign up to the GP register as a carer. We've had a few who have come back, and the GP surgeries have said that no, they're not a carer. It's drug and alcohol. You haven't got a caring role. So I have worked with Mike and Carolyn over this, and these carers have been sort of contacted and the GP surgeries. I also work alongside with drug and alcohol partners, CGL, the alcohol liaison nurses. And I think Nicky's here, the Alcohol Wellbeing Advisors, and other drug and alcohol partners. We do hospital awareness weeks in the hospital for Dry January, Sober October. And we've recently been involved in a drug and alcohol partnership project with Capital, the mental health, where we've sort of invited a lot of our carers to come along and have their say. And this is about sort of shaping some of the services, what's important, housing. And there has been some small changes sort of going forward. I think, Mike, that's probably about what I do. Unless you can think of anything else that you can
I'm just
chip
sort
in.
I'm just thinking about the type of carers that you're supporting, Kelly. What would you say are sort of some of the main themes that come up, what they sort of struggle with the people that they're actually supporting, or just in general, sort of, I know that going to the carers group, for example, going to the Chichester group, there's friendships that sort of develop and sort of peer support from each other. And, it's quite hard hearing some of the you know, of stories about what's happening sort of in their lives or their loved ones' lives in supporting. So would you say that there's any sort of like themes that sort of reoccur or struggles that sort of reoccur?
Yeah, I think a lot of the themes are services. Either sort of lack of or they're cared for not engaging, but that's around, neglecting their own health, not going to appointments. And I think a lot of our carers, the person using the drugs and alcohol have moved back in with the carers, which has been really, really difficult. And the carers' health. We've got a few carers who now use sort of over-the-counter medication to just cope, like Nytol, for example, or cocodamol. Um, but I think housing and mental health at the moment are the big themes. It's massive.
Would you say that I mean, I know that there are services there for the people with with the loved ones with addictions or the people they're supporting with addictions. Um, would you say that there's many sort of services that support the actual carers apart from sort of the support that we provide? Would you say,
Yeah, yeah. I mean, I refer a lot to social prescribers,
okay,
who are great, and carers health team, who are great. And there is sort of other little sort of groups around, there is Al-Anon. So yeah, there is some good services out there. And if we feel that the carers really getting to that point where they just can't cope anymore, then we will book into a surgery and we'll look at a carers assessment, we'll look at some funding, or we'll look at something else around their health. And GPs, I always say, go and have a chat with your GP, let them know how you're feeling, so we do encourage that a lot as well.
okay. Just thinking as well, Kelly, I know with your previous role, sort of with the drug and alcohol, you were covering the whole of the county, weren't you?
Yeah,
And you were taking on a lot of referrals.
yeah,
Anything that came through with drug and alcohol was pinged straight to you, and that was
yeah.
quite sort of demanding, sort of at
Mm.
times, because it was, it's not your only role really, because you doing the sort of general work as well, so it could get quite busy. Do you still cover the whole of the county, or is it mainly sort of the Ada,
No,
Worthing and
it's
Arran
just
now?
sort of, it's more the south at the moment, but
Okay.
hopefully we might be looking into other volunteer-led groups. We're sort of looking all into that. But we do good all the carers who are the north of the county. We try and look for groups or information. We work closely like with AdFam, Drug Fam, and all different organisations, so they can sort of see what's in their area, up in that area. But hopefully, watch this space. Hopefully, something will come up.
Okay. Well, thank you for your time, Kelly, because I know that you're really busy. You're welcome to stay sort of for the rest of the meeting if you have got time, because we've got Nicky Smith coming on next
Yep.
to talk about her role and the work that Nicky does. But no, we really appreciate that. I just wondered if anyone had any questions for Kelly before we pass over to Nicky. Yes, Penny.
Hey Kelly.
Hello, Penny.
Hello, lovely to see you. Um,
Hello.
I've just got a query around carers assessments
Mm-hmm.
for carers who are affected by loved ones' alcohol drug use. Um, so for instance, you've described that sometimes the person is living with the person who's using alcohol, misusing alcohol or drugs, or sometimes they're not. So for instance, a parent is providing a lot of support for somebody with they say that, so say they're under CGL, they're under a service,
Mm-hmm.
but the carer is providing a lot of support, that they're not, they're able to maintain at their own home, You know, they're able to maintain their own sort of fundamental needs, but they're constantly looking after and looking out for the other person all the time. Would it still be okay in terms of their requirement for a statutory carers assessment, just from the point of view because they want to capture the amount of care they're actually providing their loved one with, for them to kind of help feel like they've doing a bit of planning for the future for when they're not there anymore? Is that something that could be open to a carer?
Yeah, absolutely. And I mean, I referred one of my carers actually only sort of about a week ago, but she also had another caring role. But yeah, and when she had the carers assessment, she did feedback to me that it was really beneficial because it was more in depth and she could just talk about everything. And carers assessment did put other services in place and how to keep her safe. But yeah, absolutely, definitely.
Because I think this particular scenario I'm thinking of, she knows she can't do it forever. And so for her to start planning for the future, she kind of needs to feel like everything that she's having to do for her loved one is being captured before she can kind of move on to what happens next. So is there a good way for me to indicate that if I'm filling in a referral into you on the professional form on the website? Is there anything that I should make sure I include so that it gets picked up?
I think just what you said about capturing everything and planning for the future, because a lot of our carers, you know, some of our elderly carers worry and say, look, I'm not always going to be here. What's going to happen when I'm not here, and what's going to happen to the care force? So definitely, if you just put down about capturing all of that, and it helps services sometimes as well, doesn't it, when you've got that carers assessment, because we know it's a legal binding document. When you've got that, it can just make some services sit up and realise the impact that it is having on the carer.
Brilliant, thank you so much.
Thank you.
And I think I'll just add into what Kelly's just said about the carer's assessment. I think it just validates things for the carer as well, knowing that they actually are doing a good job, because you know, a lot of carers are sort of do question themselves whether they're doing enough. And we know that they do so much, and it just validates that sort of for them. And quite rightly, what you're just talking about, the contingency planning, sort of thinking ahead, the what ifs, just capturing that so that they are sort of planning ahead for the future. So, yeah, definitely, I think that's the route to go. Is there any more questions? Okay, well, thank you, Kelly. That was brilliant. That was great having you here to join us. And I'm going to hand you over to Nicky Smith. I've seen Nicky on here earlier, so
I'm here.
Yay! Okay, Nicky, can are you okay? Because you got your presentation. You're all right sharing, are you?
Yeah. Oh, are you sharing it or am I sharing it? I didn't know.
I can share it if not. So
well, yeah, because I think because I'm Google here, I don't know how to do that on Teams.
No problem. Just give me a second and I'll get it.
Thanks. Sorry. I can see it my end, but I can't get it.
Yeah. No problem. Just make sure I get the right one.
Yeah, I was quite impressed that I managed to get it into a Microsoft format, I think.
Let's have a look.
I'm wondering if is it easy your end, Mike?
Yeah.
Sorry.
So I've been having problems with Teams as it is today.
Oh, sorry to be added to.
No, not at all. Not at all. Let me just sort of get that sort of ready for you. Nick, if you want to start with sort of your introduction, and then I'll
Yeah.
get it sort of up and running.
Yeah. Hi everyone. I might know some of you on the call, I might not. So my name's Nicky. I'm the Alcohol Wellbeing Advisor for Adur and Worthing Wellbeing, which sits under Adur and Worthing Councils and is fully funded by Public Health. There are other alcohol advisors like myself that cover the different areas of West Sussex. So we've got hubs in Arran, Chichester, Crawley, Horsham, Mid Sussex, and Adur and Worthing. So there's an alcohol advisor that would cover across West Sussex area. I think like these are new slides that I've been working on. So I would actually be really appreciative of any feedback, because I think sometimes with talking about alcohol wellbeing and what it is, it can be difficult for people to understand what type of prevention work we are trying to do. So I've kind of put together these slides, but again, any feedback I really appreciate. So I thought we'd just look at maybe some of the estimated harms across Adur and Worthing, which is predominantly the area that I cover, what the alcohol guidelines are, what are some of those associated health risks that we're trying to prevent. A quick look at the audit C, which is the first 3 questions of the full audit that we use to assess someone's alcohol use. And ideally, I think if we can all get a little bit more comfortable with maybe asking those questions earlier, we can start to get people accessing support quicker. I've put in a little case study and there's some links. So if you want to share the slides, Mike, you can.
Okay, thank you.
If you want questions, then you can. So next
Just tell
slide.
me when, next slide, yeah.
I think I covered the next slide in my ramblings there. But basically, the service is fully funded by Public Health. What we offer is an alcohol assessment. And if someone meets the remit of the service, then we would then offer them up to 6 private and confidential one-to-one sessions to discuss their relationship with the alcohol and how we can move towards a reduction. We can do that in a completely mixed and blended way, so face-to-face, online or telephone. And it's just an opportunity for people to just have that safe space to discuss alcohol, because I think sometimes there's that stigma around discussing alcohol that people are going to think they've got a problem, and actually this is the complete opposite of that. This is trying to capture some maybe problematic or unhealthy behaviour and correct it before it starts to become an issue. So I very much see the service that we offer as we're trying to prevent hospital admissions. We're trying to prevent people going up to CGL levels. We're trying to capture them before it becomes that. So next slide, please, Mike. So when we look at like the local picture across Adur and Worthing, I'm going to say these figures are probably slightly out of date. I think Public Health done some work in around 2018, 2019, pre-COVID, and this work got published probably in the last couple of years. So when we look at the areas, when we're looking at Worthing, we're looking at the hazardous drinking and the harmful drinking columns. So there's 14,000 people in Worthing and roughly about 8,000 in Adur that are drinking in a, well, I don't like the word hazardous, but they use that, but it would be in an increased risk. So there's some behaviour there that we could maybe look at reducing. And then the harmful drinking, mild dependence, that's your higher risk drinkers. And again, we work with people in both those categories. In the last category, probably probable dependence, that's where we're likely to see most of the people being referred into CGL for alcohol dependent services. And the people at the beginning of the list, carrying us, you're drinking, brilliant. So if we could move on to the next slide. So these are the alcohol guidelines that the Chief Medical Officer recommends that we drink, which is 14 units a week. So this is what it looks like in what I call layman terms, which when you look at it like that, it doesn't seem like a lot. And when we go back to the previous slide and look at those figures, we can actually start to build a picture of actually how many people are drinking at least double the recommendation. So we're looking at people that are maybe drinking between 30 to 50 units. Those people would be at an increasing risk to their health. People drinking above that, then they'd fall into either a higher risk or probable dependence category. And so I quite like to show people this because it really just highlights quite simply anyone drinking above this amount per week would actually be scoring positive on an audit. So next slide, please. So then when we look at when people do start to drink, at least double the recommendation, or in sometimes, you know, when we look at the men's health risk section, someone drinking 4 times the Chief Medical Officer's 14 units a week, it would literally put them 4 times at risk of hypertension. So we might start working with people in the wellbeing team that have concerns around high blood pressure. Women's health risks are around 30 units a week if someone's drinking that, and that will double their risk of getting hypertension. And when you look down at liver disease, it's so high, it's like 13 times. So we're really trying to capture those people. So we're trying to avoid those, we're trying to prevent those health risks that come associated with drinking at least double or more the guidelines. And I think we probably all know people that do fall into that category in our own families and friendships. And so it's these people that we are really trying to reach and work with. And so, yeah, next slide, please, Mike. I've put this in because I thought if you wanted to share the slides out with everyone, Mike, there's a study there that there's a link, hyperlink, and it's a really good one. I think sometimes when you have conversations with people about alcohol and the heart, there's so many people that have said, oh, but alcohol, you know, wine's good for the heart. And I'll be working with them around, well, no, actually, that's not true. But they, you know, they might have read it in the paper, or they might, you know, and this video actually kind of debunks that, because up until really recently, most of the studies have been commissioned by the alcohol companies themselves. So they're always going to report on themselves favorably. And so this is a part of trying to kind of get the awareness out that alcohol isn't good for the heart. I know that we've maybe grown up to believe it or read it. It's just not true. So I thought I'd put that in for people. And the next slide. Alcohol and breast cancer. There's more and more studies being done in this now, and I've just linked the study from Emma Davis, which I thought if people have got an interest in this, then it's a really good study to read. I think for me, what really jumped out is that actually there are no safer limits for women who are drinking alcohol. Any alcohol puts women immediately at risk of developing breast cancer. So again, it's about educating women, of working with them around their alcohol, so they're minimizing as many risks as possible, while still trying to have a balanced approach, I suppose. But again, there's a study there if people are interested and wanted to read it. Next slide, please. I've included this just as I do like to prompt and push it as much as I can. The audit C, so this is the shorter version of the full audit that we use to assess someone's alcohol relationship with alcohol. The first 3 questions, I think, are the really key questions. And I think when we are working with people, it's getting maybe used to actually asking people these questions, but they can come out really naturally. So you can kind of start to do your own mini little audit. It doesn't have to be this formal thing, but it's just really asking someone, well, how often are you drinking? And, oh, and what are you drinking? What does that look like? And actually, has that been something recent or over the last year? And just by asking those questions in quite a friendly way, we can actually score someone and actually indicate whether or not, oh, should we be completing the rest of the full audit here? Will there be more positive scores, or actually is that an accurate picture? And we can actually start to kind of look at the alcohol pathway for people at that point. I would always encourage a full audit, but I equally know people are really busy. But I think if you are working with people, these are 3 really great questions just to get your head around, well, actually, is there some changes that person could make? And if so, obviously, where could I send them? And so next slide, please. And so this is just to give you an idea of how the scores are worked. So with the first 3 questions, which is the short audit C, that would be the positive scoring. So if someone scored 5 to 7, they're in the increasing risk, so they're hazardous drinkers. 8 to 10, they're that higher risk drinkers, maybe some binge drinking going on here. 11 to 12, the potential of possible dependence. Obviously, we say possible dependence because it's not black and white, it's a very grey area. If someone was completing the same full audit, you can start to see actually the scores are treated slightly differently. So the full audit, you get a much bigger picture of someone's drinking. But I think in quick-faced environments or brief advice environments, the short audit works really well. Sorry, next slide, Mike. So these are just some, I think we can probably slide through these quite quickly, but actually the reported benefits that come back from when someone actually changes their relationship with alcohol, starts reducing, whether they've chosen to give up or whether they've chosen to reduce. Most report better mental health improvement. Their relationships start to improve because they're actually showing up authentically. They're showing up clear-minded, they're showing up maybe with a little bit more compassion, and access to the restorative sleep, REM. When we drink, we do not access that part of sleep, so we tend to wake up in the morning feeling quite groggy. Might not be a hangover, but you're just not firing on all cylinders, and so access to that, people, yeah, you can see it. Next slide. Obviously the reduced health risks that we've covered, which obviously quite a weighty subject, and then obviously weight loss can come as a bit of a quick win when we look at the calories in alcohol when they're reduced. People do report weight loss, which is great. Next slide. Less hangovers, obviously that's a no-brainer. The increased energy, I think, is also something that I recognise in the people that I support. These are just, and I think the beauty of alcohol, and when you do reduce and work on that side of yourself, the benefits start coming in quite quickly. It's not something that people have to wait months and months to feel the benefits from. It's really quite quick. And so a few changes actually can really help. Next slide. Yeah, so I just thought I'd just put a bit of, what support is available, because I think sometimes people People do get lost out there when they don't really know where to go. I would say for brief intervention, your GP and the pharmacist, your pharmacist would be able to do a full audit with you because they do health checks, and that comes as standard with a health check. And your GP would be a good place to start as well if you didn't know where to go. I think we're really lucky in Worthing and West Sussex, Chichester, because we have specialist workers. We have Emma, Jane Stringer, who's our alcohol liaison nurse, who I work closely with Emma with. And there's also her counterpart in Chichester, so they're invaluable to our area, actually. Next slide. Tier 2 commissioned alcohol services, so that's where Alcohol Wellbeing sits in. We're commissioned to deliver extended brief interventions, so that's 6 free 1-hour sessions, as well as an assessment. And equally, Drink Coach, they offer the same, other than that's online. So they have the app, and they also have the alcohol test, and you can access 6 free sessions with their online coaches as well. And I do believe they do weekend support as well as evening support. So again, it is just really nice giving people that option. And so this would be for non-dependent drinkers. So this is prevention, working with people scoring between 8 and 19 on the audit, the full audit. Next slide. And then we go up to our tier 3 services, which is Change, Grow, Live. They are commissioned across West Sussex, offering group work, medical prescribing. They have nurses. Their offer is extensive. So, but this would be for people that are scoring 20 plus on the full audit. And so, yeah, the next slide, I can't remember what this one is, Mike, sorry. And then I would discuss relapse prevention. So Smart Recovery, AA, CA groups, and Build on Belief. I think going back to what, Mike, you were talking to Kelly earlier, I would say that Smart Recovery and AA do really good support for carers with alcohol. Where they're caring for someone with alcohol. They have regular meetings. And Build on Belief, I think, again, we're really lucky in Worthing that we now have them based in Worthing. I think they've also got services running out of Bognor as well. But their website is, and again, the hyperlinks are on, so I'm more than happy for them to be shared. And then the next slide. And then I just put these on. I would say if you do want up-to-date information around alcohol as a subject, always start with Alcohol Change. They are actually working with the commissioners in West Sussex at the moment on the co-occurring conditions and substance misuse protocol. Having gone on to that training yesterday, I just want to encourage carers to access their statutory rights of getting a carers assessment, especially in that category of carers, because they're often going through very, very challenging times. So just wanted to echo that. I've put in Drink Aware, again, a really solid space to go for up-to-date information. And join Club Soda. I like this organisation. They do courses, they've got podcasts, they've got low alcohol shops that people can actually just try and sample lower alcohol contented products. So I like to promote them as well. And then I think that's, I don't know, is that the last slide, Mike?
I think you got just 2 more.
Oh, God, sorry. Oh, this is just a case study. I'm not going to really go through it, but I thought if people wanted to read it afterwards, it just kind of shows a really nice way of when someone comes into the service, she scored like 18 on the audit, the full audit, which put her at high risk. On exit, she'd reduced down to a 12, which was one category. So she's now in the middle of increasing risk. But all of her scaling questions around her mental health, her physical health, and overall quality of life actually also improved as well. So it's not always rocket science. I thought this was a really nice one because it was actually just a couple of swaps and she got a reduction. But again, you can read that at a later date. And then I think, and that's, well, yeah. Obviously, if you wanted, if people did want to refer anyone in or access support themselves, you can phone the main hub number, or you can make an online secure referral using the website as well. And yeah, thank you for your time. If there are any questions, I'm happy to take them.
I'll stop sharing now. Oh, that was brilliant, Nicky. Thank you. A lot of information to take in, which, you know, I'm going to share around when share the slides around, because there was a lot, and there was a lot of useful links as well on there. So
I thought I'd try and hyperlink things in. I think the only thing I've realised that I haven't hyperlinked is just now, I've just seen that comment for Chichester Wellbeing. Yes, you would. Yeah, you just go on to Chichester Wellbeing, and they would have their own wellbeing hub. I would say most of the different hubs across West Sussex have a similar offer, but some would be different because of the demographic. So if you're like Chichester, might have more rural populations than coastal areas. So you know, so it's like it can differ. And I think in Arran at the moment they've got a cooking course, and it's brilliant. So if you've got clients in Arran, they've got a really good cooking course. So it's good. But sorry, Mike.
I think I remember when I was working sort of with the drug and alcohol team sort of within our organisation. We did a lot of work up in sort of Crawley and Horsham area, and there was a similar sort of wellbeing service up there. I can't think of the name of the staff that were up there, but I'll try and find out.
Crawley have a van, so they do outreach by their wellbeing van, and so my counterpart, who's lovely, is Catherine, and so she's often out and about doing outreach in Crawley. My counterparts in Chichester, one does the town, one does outreach in the rural part. So we do try and be as flexible as we can to get people in.
They've not given you a van then?
No, I did ask one. It didn't go anywhere, Mike.
Oh.
But if there's no further questions, that's cool. I don't know whether there's any in the chat.
No, just some nice comment from people saying that it was a good presentation, and that, you know, yes, we'll send the information. Yeah.
Oh, Hannah's got her hand up.
Yeah, sorry. I had to leave for most of your presentation, which was slightly annoying because I did want to see this, because I was just wondering about whether you have a cutoff for how much alcohol someone drinks before you think they can't actually be referred into your service, or do you do the assessment and then decide?
I think if we already know someone's alcohol dependent, we would probably refer them straight into CGL, purely because it would be what we're trying to do is get people quicker in the alcohol pathway. And so I would say for people that haven't accessed services before, I would always, so if someone's never accessed CGL and we're unsure about their drinking rates, I would always, as a precaution, say I'll assess them, because if I can get them in at prevention level, I'd rather do that than referring straight up to CGL.
Okay.
I think if someone's already got a history of alcohol dependency, or I would say sometimes if you're aware of someone's medical records, it's not always the case, but if someone's prescribed thiamine, that's usually a really good indication that someone has been drinking consistently for quite some time, so they would probably be deemed CGL.
Right, brilliant, thank you.
Okay. But equally, I was going to say, if anyone does ever want to discuss an alcohol case, I really am available. I'm more than happy to talk it through. So again, please reach out.
No, it's brilliant. Thank you, Nicky, for your time and
Okay.
for putting all that information. You're welcome to stay sort of for as long as you can for the meeting, but I know you're very busy, so we sort of appreciate you coming along. We're moving along quite nicely today. So next we have Caroline, who's going to be talking with Katie. So can I pass you over to Caroline and Katie? It's still on mute.
Right, there we go. Sorry, I couldn't unmute myself then. I lost the button. Hi, everybody. Thank you, Nicky, for that lovely presentation. So our practice spotlight today is with Katie. Are you there, Katie? Is Katie on mute as well? Katie, are you there? She is here because I saw her sign in. She disappeared.
I can't actually
Wow.
see her, Caroline, on all of the
She was in earlier. I saw her sign in and she seems to have disappeared now. That's odd, isn't it?
Maybe she didn't want the spotlight.
Well, she was expecting it. I saw her yesterday. I saw her sign in. I let her in and now she's disappeared.
we had
so
dropped down 2 people from 29 to 27 in the last 5 minutes, so
maybe her internet has dropped out or something. What should we do, Anna? Do you want to?
I can go first if you want. Do you want to try and give her a call, Caroline?
Yeah, I will do.
Okie dokes, well, change in order and you get me instead. And also I was going to use the available time at the end, so who knows how long I'll speak for. Mike, can you remind me what time these meetings usually finish?
Finish at 12. We've got until 12 o'clock.
And Caroline, how long are you guys kind of planning to speak for?
About 20 minutes.
20 minutes. Okay, so I'll have about 20 minutes then myself. Well, hello everybody. Hope you're all doing well. I haven't seen lots of you for ages. I just wanted to come online to communicate a couple of things today. First one is, well, I suppose the first one should lead to the second one. So the first one is actually about the primary care engagement project itself. So Caroline, Mike and myself all began delivering this project. Mike was a little bit later coming online, but began delivering this project on April the 1st of 2023. And it was a 2-year funded project by the Integrated Care Board. So if you're any good at maths, you'll realise that means that it's due to end on the 31st of this month. And we did seek continuation funding from the Integrated Care Board, but all of their health inequalities money is being wrapped up and there is no continuation funding. So that puts us in a position where the project is due to end at the end of this month. But it's been, from our point of view, an absolute rip-roaring success. And we've been utterly delighted and grateful for all of the support that you guys have put into the work, put into the project, engaging with us, engaging with these events, engaging with your own progress in your own surgeries. And just to give you an indication of kind of some of the reach of the work, we've had more than double our referrals from before this project period to what we get now. That's actually referrals that are new to us, so we get much more than double our referrals from primary care, but some of them are already known to our organisation and registered with us, but that's carers that are new to us. So I mean, the last quarter, referrals or signposts from primary care amounted to 11% of our total referrals. So that is an enormous increase, and something that we're very proud of. And also, just amongst yourselves, we've engaged with 50 either main or satellite surgeries, looking at how you're currently identifying and supporting carers, and thinking about areas where perhaps you could implement some changes which will help carers be better identified and supported. And we've done that with 50 of you, which is just, again, absolutely incredible. And we're very, very grateful for your engagement in that work. And 30 of you have introduced carers offers, or 30 of you that we know about have introduced defined carer offers, so that carers within your patient community know how they're going to be supported by you as a GP surgery. And again, I just think that's brilliant. That's actually above and beyond all of our expectations for the project and all of the targets that were set for the project. So thank you, and much appreciated by us. You can see we've still got smiley faces though, so that probably gives you an indication that we are not going to conclude the project, and that's because we think it's of enormous value. Our organisation thinks it's of enormous value, and so do our adult social care commissioners think it's of enormous value. So what we are seeking to do, we won't be able to operate as we have over the last couple of years, but we will be continuing this forum, and it will take place as it does now every 6 weeks. We are still available, but just maybe not as rapidly available, but we are still available to support around both baseline reviews and action planning, resources, materials, and the information packs we do at key points in the year, like Carers Week and Carers Rights Day and flu season, etc. So we will still be doing all of that work, and Mike and Caroline are still available for any questions or queries you have. But it's just acknowledging that we won't be able to devote as much of our time as we have done over the last couple of years to this project. So again, just to say thank you very much to all of you, and I hope that you feel, as we do, that this has been a really worthwhile piece of work. And I think Caroline, myself, and Mike are really pleased that it's not the end at all, and that I think that, to be honest, the way that it will continue fits the progress of the work, and it will reflect the amount of capacity that's needed. So I don't think that any of you will experience any particular loss. That does lead me to my second point, which is that thankfully that does not mean it's the end of us either, because all of our jobs were attached to that project. Hurrah! We have been funded by, I think, a really to deliver another really worthy piece of work, and actually it connects very closely to what we've been doing with you guys in primary care, because it is about supporting all carers, but particularly those vulnerable carers. Oh, there's Katie there. Sorry. It is about supporting all carers, particularly vulnerable carers, with support around ensuring that their homes are warm and safe, and that they are thinking about what extreme temperatures might mean for them and the person they care for. So it is thinking about seasonal weathers, but it is actually thinking about the broader remit of energy. And so that might be things like living in damp homes, living with inadequate heating measures, and also with the cost of living crisis, it's about thinking about, actually, are people even being able to afford their bills? So, carers are far more likely to be in poverty, and there was recent research done by Carers UK indicating the scale of poverty that exists amongst carers in the UK, and it's significant, and it's far more than the general population. And what a lot of those carers are doing is they're cutting down on their food, or they're cutting down on their utilities. Already they've cut down on any of their kind of luxury or additional spending. So you might find, like I heard one just the other day where the nature of the person needing to have the heat meant that they made sure that room was heated for that individual, but the carer was actually sleeping in the lounge and there was no heating at all, despite minus freezing temperatures. And it's not good for either the person that's being cared for or the person that's living in those conditions unable to continue caring with it. I mean, they're, you know, they'd had pneumonia, they'd had pleurisy themselves, because they're picking up repeat infections because they're not able to look after their own health needs in that situation. So we've partnered with, it's actually funded by Southern Gas Network, but it's not about Southern Gas Network. They've identified, as part of their corporate social responsibility, that they've identified that carers are a particularly at-risk vulnerable group around this energy poverty. And so they have funded us in partnership with the Citizens Advice Bureau to increase energy awareness and ensure that carers have access to safe and warm spaces, that they know about toxic homes, and that they've got access to as much support as possible. So I'm going to give you just a little quick overview. And the reason we're talking to you guys about this, you'll see in a moment, is because have I got this ready? Because I wasn't planning to come in next. Hold a sec. Wake up, computer. Here we go. Mike, can you give me the thumbs up when you can see this, please?
Yep, you can see it.
Okay. So there it just it describes the opener of the work. Oh, is this actually, hold one sec, sorry guys. Let me just check this is actually, I'm going to share this one with you instead. I prefer this one. Hold a sec. Stop sharing that one. Share my screen, it'll be easier. Okay. Is it going to let me know that I've got that up? There we go. Okay, so the Carers Energy and Wellbeing project, highlight wise, it's about increasing a carer's energy, health and safety at home. So that's what we've just talked about, maximising their income where possible, and connects them to their community and wider practical and emotional support. So it's intended to be a preventative service and keeping more vulnerable individuals safe at home and reducing avoidable need for GP and
You've muted, Anna.
Yeah, it's just
Yeah,
automatically
sorry.
put me on mute for some reason. Okay, so these are the 4 components of the Carers Energy and Wellbeing project. So first and foremost, it's about reach for us. So it's, you know, lots of us at Carers Support West Sussex, as part of our general information, advice and guidance for carers, we will talk to them about how they're managing at home or how they're managing their finances. And we might have conversations with them when they talk to us about having damp homes, about dehumidifiers, or about the different heating appliances that they're using. Or we might talk to them about if they're struggling with their bills. We manage things like the household fund, and we might talk to them about managing their finances or accessing funds or grants that are available. And what we want to do is we want to make sure, because many carers, you know, there's no reason for them to be energy aware or to know that there are better deals that might be out there available to them, or there might be better ways that can heat their home that might increase efficiencies and safety for them at home. So we're going to start integrating it into every single contact that we have with carers, and that's in person at our groups, that's on the telephone, and that's through our helpline as well. So that's kind of that's about our reach. We want to make sure, we're actually hoping to engage with a couple of thousand carers during the lifetime of this project, which is 15 months, just making them aware of support that is available to them that they might not be aware of, and actually increasing how they can access the support. And this is in part where it becomes crucial to have Citizens Advice Bureau as a partner for us, because what SGN wanted to do is they wanted to increase the well-being, the package that sits around energy advice. So ensuring that carers feel supported in terms of having a physical warm space to go to, having professionals that they can engage with, but having their wider well-being looked at as part of that energy advice. So we can provide that wider package of practical and emotional support, but it's our colleagues and our partners at Citizens Advice that have the actual knowledge and the skills and the contacts to be able to deliver proper advice, or what we would say is advice with a big A as opposed to advice with a small a that we might provide in this particular area. And so some of the things that they with, every time I press enter, it's actually closing. I don't know what it is doing today. It's closing it's turning me on mute. It's not playing ball today. So I'm going to have a look at it like this. So Carer Energy and Support, they cover things like damp, mold, property issues. They talk about the different responsibilities, so who it might be, if it's a landlord's responsibility or the tenant's responsibility. They'll look at short-term solutions around furniture placements, the dehumidifiers, how to improve ventilation, all of those kind of things, dealing with the individual situation as it currently stands. But they'll also talk through things like energy issues around tariffs, billing issues, guidance, grants for help with energy costs. They've got fuel vouchers that they can directly provide themselves. They will actually provide advocacy on behalf of the carer. So that might include contacting the energy companies on the client's behalf. And they're particularly interested around the use of smart meters and the reasons that they might be beneficial to vulnerable clients. There's also support around debt and income maximisation, something we're also able to support with around benefit checks, but they'll look at the overall package, not just carer benefits in the way that we might, and advice on grants and extra support that they might be missing out on, as well as dealing with urgent debt. And then they'll think about the fabric of the home, so helping to keep a property cool in summer, warm in the winter, thinking about things like insulation, giving clients access to small measures, draft excluders, radiator reflectors, alarms, advice on solar panels and other carbon technologies. And they also can do home visits, which is fantastic, to help with property issues that we've just discussed, like damp and mold, EPC certificates, all of those kind of things. And then for carers in particular, they've got some things I think that are of real value. We talked obviously about, when they are experiencing, debt or real concerns over immediate pressing issues, they can access the household fund, which would be immediate relief, but also they can access fuel vouchers. But then in addition to those things, they have something called the Priority Services Register, which is available as an access point from ACCA. So that's not something we can provide. And that means that in those instances, they would be put as a priority client with any energy company. And that will be around tailor-made communications. It will be when there's emergency, how they're dealt with. And there's a whole range of benefits by being involved in the Priority Service Register. And other things I think that are particularly of interest potentially to us as a group is if there are clients that have got Alzheimer's or dementia, they can give out the free, when you've got a gas cooker, the valve locks, so that the individual isn't in a position to turn on or off their ovens or their gas appliances. Similarly, they can give out free carbon monoxide alarms. So all of these tangible benefits, as well as the advice that's available directly through them. And what's, I suppose, slightly more innovative, I'm just going to see what else they've got here. Yeah, they also do urgent support around accessing food and topping up prepayments. There's the Priority Service Register there, and advice with carbon monoxide. Yeah, so all of those things I've just mentioned. But what that's also particularly helpful, or the way that this is working slightly uniquely, is, previously you might be supported by us and then independently somehow supported by them. But what we've done is we've really brought our services together on this particular topic. And what we're endeavouring to do is, when we are supporting a carer and reaching out to them, asking those questions about their home environment and how they're managing their finances, we've got access to the energy advisors' calendars, and we're booking direct appointments with those energy advisors at a time that is convenient to the carer. So there's no dropping off, there's no referrals through to services, it's not a signposting scheme, it's a direct partnership where we book them into advice from the energy advisors directly, in the same way as we book them advice from our own benefits advisors on income maximisation. So this has got, real benefits, particularly in seasonal weather. We know that there's, lots of avoidable deaths that happen over the winter, in particular when people are living in inadequately heated homes, and especially for those patients who've got long-term health conditions or respiratory problems. And similarly in, for less of a period, but in summer when we have extreme heat conditions. And there's two other components. So that's all already live. We've just started that in the last 2 weeks. And the reason we're talking to you about it today is because we want you to be referring your carers, just like you do already, but just bearing in mind those carers that are probably more likely, or you'll know about them just from the conversations that they present with in front of the GP when it's clear that they're not actually managing to heat their homes properly, or when they're having to, like we heard about a couple the other day that literally walk around just wearing hot water bottles. I mean, you know, these people are living in quite devastating circumstances, and there is things that can be done to support them. And if you route them through to us, we will do our best to make sure that we look at that whole holistic package of support for those individuals. These two components here, this is what Caroline and Mike will be spending the rest of their time on now when they're not doing primary care engagement work. But I think it connects wonderfully with the work that we've done in primary care. So feedback we get from carers is they're quite often worried about the situation and circumstance of the person they care for in terms of, is their health deteriorating? They're never quite sure. You know, you're living with pretty much a permanent anxiety when you're caring for someone, when their health can go up and down. It can be urinary tract infections, it can be that their temperature's changing, it can be that, you know, they show signs of dehydration, but you don't know when you should go to the GP. You don't know when they're actually deteriorating in their health. And we've had feedback that it would be really invaluable to have a bit more knowledge and awareness and training themselves on the signs to look out for. So there is an existing product which we hope to use ourselves in this area, but if not, we'll develop our own, which is about resources and training to spot carers, see the signs of deterioration in the person they care for. And in your world, it'll be stuff you're really familiar with. It will be, you know, stool charts, it will be urine charts, it will be looking at skin discoloration, it will be temperature information, and it's looking at the 7 signs of health that show deterioration for the person that they care for. So what's actually happened is in other areas that has been developed for care homes or for clinical purposes, but what we want to do is look at how that can be developed specifically for carers. And what we want to connect that to is a health pack, so the tools and materials that will directly enable them to do that. And again, this feedback has come from carers themselves, where some of the main things they would find really useful is a thermometer, a pulse ox monitor, blood pressure monitor, UTI kits, potentially a diabetic kit if it's diabetes, and the urinary test sticks as well. So it's very simple things, but it just gives them a greater sense of control and being able to care for the person that they look after at home. So that's something that we're just starting to develop at the moment. As I say, these guys, we've only started this project in the last couple of weeks, so that it is in development at the moment. But I think this will particularly align to, you know, when we're thinking about seasonal conditions with your flu vaccination drive for carers, and how we can combine some of this activity, or how we could seek to collaborate over information sharing with carers and empowering them in their caring role. And this then connects also to this safe hub. So we already deliver groups across the county, that there'll be a variety of ways that we do that. It might be events, it might be walking groups, it might be coffee mornings, it might be drop-ins, but we create a warm space, a safe space where an individual can come along for a cup of tea, meet a professional, and gain both professional and peer support. And what we want to do is we want to not duplicate that offer, but add to that offer where there's gaps at the moment in how we're supporting carers. And we want to make sure that those spaces, well, firstly, they'll be manned by Caroline and Mike, who have a wealth of information and knowledge on how to support carers more generally, but they'll have specific knowledge on this significant 7, and they'll have general knowledge around energy awareness. So that's sharing energy literature, creating additional drop-ins and warm spaces, and providing more in-depth info sessions and training on this significant 7. And that's an area we'd like to see. You know, some of you have got very small spaces and some of you have got very big spaces. And if any of you are interested in partnering with us in any of those safe hubs, we'd love to hear from you. So if any of that has been of interest to you, or you'd just like more information or a chat with us about what this looks like, then please drop in the chat that you would be interested in having that conversation with us. But otherwise, I hope that you see the benefit of this work, particularly to those probably older, more vulnerable more vulnerable patients and carers who will be in their homes and not necessarily being in a position to adequately heat their homes or keep them cool in the summer, and the risk that poses to them, to their health, but also just to their whole quality of life when they're not able to actually meet their own utility bills, and the stress and the anxiety that induces. So I did talk for longer than I expected, 25 minutes. I always speak for longer than I expect. I will stop sharing my screen. So, oh, great. That's nice to see we have some messages in here because I couldn't see any of that. I'll have a look at those messages as Caroline talks through her best practice. Has anyone got any questions that they would like to ask me before we go through the next section? Hi, Penny.
Hi, Anna. Sorry, I'm just not great at typing, so it's easier to
Yeah, no, that's
to
great. I
ask.
find it easier as well because I can't keep up with the chat
By
when
the
I'm
time I've
rambling
typed,
on.
it's like, oh no. So, just briefly with the significant 7, I think that's really, potentially exciting. One of the things that I'm just sort of like thinking where that might go is once carers have carried out some of those tests, they have a concern because they've spotted a deterioration, whether in that project there can be some support around how's the best way to communicate or what they are seeing. So you may want to have a look at SBAR.
Okay.
Which is kind of like a communication situation background assessment, and so it's a way that can be used to filter how you're having the conversation, because often we start with, I know myself, may start with information that's actually got of no relevance whatsoever to the immediate situation I'm trying to communicate. Yeah. So when you just trying to get through to someone to talk to somebody about the deterioration, or having to write it down on a forum to contact your GP if there's something that you're concerned about, I think it would just be helpful for an outcome to come from spotting a deterioration if communication in some way can be included in part of that scope.
I think that's a brilliant idea, and I'll have a look at that and definitely give that a thought. And to be honest, it might be something we come to certain, like, that's what's wonderful. I do think we've built really strong relationships with you guys, and it ultimately will again help, I think, in terms of reducing the amount of times that an individual might call a GP because they're uncertain. So it'd be great to connect as we develop that. I mean, there isn't a developed tool, but I think we will need to do things that set out around that. So as we do that, it'd be great to connect with partners to make sure that it's fit for purpose. Fab. Thank you, Penny. Any other questions? Okay, great. Well, I'll have a look at the chat now. As I say, if anybody is interested in getting more information from us on what the project is, or if anyone is thinking maybe we could have a safe hub, or they'd like to connect with us over key drive periods around seasonal ill health, then please do just drop your contact and what you'd be interested in the chat, and I'll have a look at that, or Mike, myself and Caroline will have a look at that after today. So wonderful, thank you. I hope you all do see the benefit of that activity, and we look forward to carry on working with you in this capacity also. So cheers, and I will hand back over. I'll hand straight to you, Caroline, now. Caroline, yeah?
Yeah, thanks very much. That was great. Thanks, Anna. Katie, are you there? She was.
I am, sorry. I had a bit of computer issues, but I'm back. So if I disappear again, I'm really sorry, but
that's all right. We're glad you're here. That's fine. Welcome. So, Katie, we've got 20 minutes. Would you like to introduce yourself to us, please?
Yeah, sure. Hi, I'm Katie. I'm one of 4 of the care coordinator team at Witterings Medical Centre. I came back from maternity leave in September and was given the role of carers lead for our practice. So I'm relatively new to it, but I think we've done quite a bit of work since I've come into post. So yeah.
Right. Thank you and welcome. Okay, let's get down to it. So Katie, can you just give us a little overview of what made you begin developing carer identification and support in your GP practice?
Sure. So as I said, I came back into my role in September, and I believe I met with Mike at the end of October, and we did a baseline review, and that was really helpful. Just sort of outlining what we did really well in the practice to do with carers, and what maybe we could look into just to see if we could improve. And that was really handy for us. And also, I find these meetings really handy as well, especially the spotlight surgeries, because then you can look at what other peers are doing and maybe sort of share some ideas as to how to improve care identification at your own practice.
Right. So you've really just started implementing changes since October of last year.
Yeah.
So could you just give us some examples of what steps you've taken since then?
Yeah, sure. So the main one is that I've been looking at our current carers register and trying to keep it up to date, because I'm not really sure previously what had actually been done, and whether or not people were engaging with it to you know, register as a carer with the practice. And one of the main ways I did that is I created a questionnaire that I can send out to patients that are currently on the register, just asking if they were still a carer, and if they were still a carer, who they cared for, essentially. And I got a really good response with that, so that was really, really good. What else did we do? So after we spoke with Mike, we also have implemented the carers support training, the carers awareness training, and that's been really good as well. I think it's important that we not only offer that training to admin staff, but also to the clinical staff as well, so that they can obviously identify who is a carer and whether or not they need any more support as well. So that's now a mandatory training for all staff at the practice.
So is that for all staff? Yeah.
Yes.
Yeah, that's great. Okay, that's really good. Oh, and the questionnaire, how did you send that out?
So it was via text message. So
message.
The majority of our carers register had a mobile associated to their record, so that went out to them, and we had a really good response. I think there were about 300 patients that were on our carers register, and I think I got a response from maybe about 2/3, maybe a bit more than that. So I was really happy with that, and yeah, it was a really easy way of doing it too, because it was literally just you saved it to their notes, and it would update the register, especially if they said they were no longer a carer, then they'd come off the register.
Okay. So would you say that you have noticed some benefits and positive outcomes of the work that you've been doing with the primary care project?
Yeah, definitely. There's been a much bigger uptake, I think, as well. And we're really lucky here because we have a patient information centre, which is something that I know a lot of practices don't have, or they maybe just have a section where they have leaflets. But we're really lucky that we actually have volunteers come into our surgery, and they're there Monday to Friday, 9 till 12. And patients, or anybody really, can come into the surgery and speak to them, and they'll offer advice and signpost, and they're really, really good. Sort of invaluable resource to have, really.
So we'll talk a little bit more about that, because we've got some photographs that we're going to go through in a minute. But yeah, that's an interesting point to bring up again. So you've done quite a bit of work since October. It's early days, I know, but what are your plans for the future, if you have any? What's coming next at Witterings?
So I'd like to be able to either send out another questionnaire or figure out some way of trying to capture more of our practice list. We have about 10,000 patients here, so it would be nice to be able to just send out a questionnaire to say, are you a carer, or are you looking after someone? And then we can then update our register further, and then that then enables me to be able to send out messages about things that are happening in the community that maybe they'd benefit from, or information that we can send out via text message, which is maybe like a link to a website like your website, or yeah. So I'd like to be able to capture more carers, because I know they're out there.
They're out there. Definitely. Right, you sent me over some lovely pictures, so I'm gonna just share my screen, so bear with me. I've got to Just let me know when I'm sure. I think that should be it. Yeah.
Yeah, I can see
Can you
it.
see that?
Yeah. Yeah.
I go into slideshow from the beginning. There we go. Okay, so hopefully I can get off this page. Don't know. Should be able to. Right, what's this, Katie? Can you just talk us through this?
So this is a photo of our patient information centre, as you can see. This is placed really well, I think, because it's as soon as you come in the door, so you don't even have to go around to reception or anything. It's right in front of you as you walk in, which I think is really helpful, especially, as I said, if there isn't if they're not a patient and they just want some information, then they can pop in as well and speak to the lovely ladies that are there. They're lovely. They're all volunteers. A lot of them are part of the PPG, so they're very knowledgeable, and they have a lot of knowledge about what's going on actually in the community as well, so they're able to signpost. And it's not just carer support. They offer, there's leaflets on all sorts in there, all sorts of health conditions, so there's a lot of information there, I would say.
That's fabulous. It's a really great way of using your PPG as well.
Yeah, absolutely.
Yeah. Okay, so this I think this is just part of the information that they might hold at the Patient Information Centre. So what's this, Katie?
Yeah, so this is the carers registration form folder. The patients can also register as a carer on our website as well. We do it that way. But if they'd rather come in and speak to someone, then they can fill out this form and hand that to reception, and then it makes its way to the care coordinator team, and then we then input that on their notes and update their notes to say they're a carer. And if the patient they care for is a patient with us as well, then we can also update their notes too.
Lovely. And then we've got one more picture. So this is just well, you tell us, what is this?
It's carers information for old people. So we are quite an elderly community, I would say, in Wittering. We have a lot of retirees and a lot of aging population, I should say. So I think this part is really handy to have. It's just a lot of information about where they can access carer support, anything health-wise that helps them out, and as I say, any community and events that are going on as well, and as well as care support, as opposed to carer support, also care support as well for agencies, like that.
So you include any sort of social events or events that the surgery is hosting, coffee mornings, things like that. That all is information that is included here.
Yeah, absolutely.
Fabulous. Thank you. I will stop sharing and open it up to any questions from anybody. If anyone's got any questions for Katie. Looks like you're off the hook, Katie.
I just wanted to say that when I went into surgery the other day, I got to meet the volunteers, and they're absolutely lovely. Lots of knowledge. Yeah, and they're very, very sort of proud of what they do there. So yeah, well done. They're a credit to the Witterings.
They really are. They're so knowledgeable, and they love a chat as well, which I think sometimes people just want to have a chat. So, and they're perfectly happy to just sit and chat, have a cup of tea, and not necessarily have to give out advice or anything, but it's just nice to have someone to talk to, I think, sometimes.
I think you're very lucky with where they're positioned, like you say, sort of between the pharmacy and the sort of reception. It's an ideal spot. So yeah, good.
Yeah, and it has shifted. I mean, we've had a bit of an not recently, but we had an expansion of our surgery, and it was where the pharmacy is. It used to be where the reception was, and then the waiting room used to be where the patient information centre was. So I think it's a much better configuration now.
Yeah,
you can just walk in and see it.
So we've got a question in the chat Katie, do you hold carers events, and also who are the volunteers? So you said you've got some PPG members, but not
Yes.
all are PPG members. So
No.
first of all, do you hold events at the surgery?
So we haven't had any events at the surgery as of yet, but there's plenty going on in the local community, which we obviously signpost patients to. But it is something that I absolutely will bring up and see if we want to do something like that, because I think it would be great to send that information out to patients and see if they want to come to one. Absolutely. In terms of the volunteers, as I say, they are PPG members, but a lot of them are just patients that are just happy to volunteer their time and speak to other patients or indeed just people who are visiting. They're quite happy to just have a chat. So yeah, anybody can be a volunteer.
Lovely. Any other questions? Don't like it. Thank you so much, Katie. We really appreciate you coming along and talking about Witterings and telling us all the work that you're doing over there. It's much appreciated. Thank you.
Thanks for having me.
Just want to thank everyone for coming along today and for sticking with us, because there was a lot of information, a lot of guest speakers to talk, and it's been really valuable. We'll make sure that you get copies of presentations and slides, and the video will be uploaded to our primary care page as normal. So just to say thank you, and we'll be sending out the invites for the next one very soon. And Anna would like to say something.
Yeah, just to echo what you said there, Mike. I know a lot of people always ask for the slides, but just after these events, Mike is always fantastic, downloads the video, and we get that uploaded onto the primary care platform, which hopefully you all are well familiar with now. But we also add all of the PowerPoints and anything from that particular Carer Lead and Learning Network event gets added. So for all previous Lead and Learning events also, you can always access the video, the PowerPoint slides from each of the speakers, and any resources that we reference. So just to make you all aware of that is always available for each of these sessions. Cool, thanks.
I've just seen a message from Nicky about stickers, awards. Yeah, we are going out giving awards and stickers to people. We are contacting surgeries individually to talk about that, to see if they'd like one. So I will contact you later, Jo.
We were only yesterday. That's the one thing, is we were all guns ho with that, which we obviously will be, and we'll be getting out to you all. Just bear in mind that at the moment we're very quickly trying to mobilize this other project, so we're a little bit heads down for the next 4 weeks, but then we'll be able to kind of reconnect more generally on those things as well. But they have them, they've already been going out and delivering them, and it's a really lovely moment, I think, for us actually, when that happens. So they are there and they are coming out.
Okay, well, thank you everyone for your time, and we'll see you all again in about 6 weeks' time. Thank you for coming along.
Thanks very much,
everyone. Bye.
Bye.